Hi, I'm Sharon Lemoine, nurse practitioner, and as you know, type 1 diabetic, and I love my golden doodles. But today we are talking more about concierge medicine, what it is, and what that looks like with an average patient. So a lot of people ask me, what is concierge medicine? What's the difference than just going to my regular doctor? The concierge medicine model encompasses a more thorough root cause approach. We are excited because we're diving more and more into that functional medicine, focusing on root cause and really getting to the source of the issue or problem versus just being quick to throw you on medication. So we're really excited about that. We're also diving into gut health, lots more videos to come on that. I can't wait to share that information with you. For right now, we're contrasting concierge medicine and primary care. So as you have all, I'm sure, experienced, when you go to the doctor, it seems very rushed. This is no fault to your doctor. Again, they're very overworked. Our system is not able to keep up with the demand. Your primary care doctor might be seeing, 20, 30 patients a day. So when you get that 15 minutes and it's like, okay, you get your one thing that's bothering you, you can't talk about anything else, and you're in and you're out. In our setting, we take all the time needed. We bring you in for that first appointment. We talk about things such as, what's your family history? What does that look like? Genetic predispositions to any health issues. That's a big one. The other assessment pieces to that is talking about your past medical history. What medicines have you been on? Surgeries. And then more importantly, what is bothering you today? What brought you into the office? And quite often, people can't put their finger on it. They're like, I just don't feel good. So we're able to take the time to dive in, really dissect. What's the sleep pattern look like? What's your relationships look like? That's a huge one. What's your family support, community support? We always hear about reducing stress. Well, that's a lot easier said than done. We all have crazy stress in this time and day. So we talk about all of these facets that actually affect your health. And again, today, and what are you going to look like 20 years down the road? We are all about preventing disease. So as you know, in concierge medicine, we really establish a personal relationship with our patients. And today we have Fran here. We've been seeing you for like a year and a half. And Fran has come to us with multiple concerns about her issue or her health, and really wanted to take an overall approach to getting healthy. So I'm going to let Fran tell us a little bit about, what led you to pick up the phone and say, hey, I really want to get healthy and take those next steps.
So believe it or not, it was my husband. My husband had researched bioidenticals, hormone replacement for years, and he was a biology student, and so he was very versed on menopause. He had educated himself about it, and being a busy professional, I kind of, yeah. As I grew a little bit older, the effects of menopause were pretty significant for me.
So what kind of symptoms were you feeling?
So the symptoms were the significant hot flashes. As I said, I'm a professional. I do a lot of presentations. And kind of what broke the camel's back is I was in front of board members, and I had a piece of sweat, a drop of sweat actually come off my nose. And what followed with as the menopause continued was anxiety from, oh gosh, am I going to get a hot flash? Or trying to get ready for work and having to take pauses in front of the fan after I spent an hour doing my hair. The other was very mentally emotional. My mood swings were very unpredictable. Joint pain was significant. Like I would be in a sitting position at my desk and get up, and it was like I was, 80 or 90 years old. I'm in my 60s. I still
And you look great.
Thank you. And it's like, the new 40s to me.
That's right.
And so one night when I couldn't sleep, which is part of the side effects, I was on my phone and I saw a video of Gig Harbor Medical Spa in Sharon. And it was almost like, oh my gosh, someone understands. And so I spoke to my husband. He drove me here very quickly when I made the appointment. And after about an hour of speaking with her, it was a very emotional appointment.
We want to validate your symptoms and what you're going through. I think women as a whole going through menopause, and many professionals have spoken about this. This is a big hot topic, how women have been discarded once they hit those perimenopause, menopause stages in life, the symptoms they're having. Our primary care doctors, God bless them, they're very overworked, but they're very quick just to throw you on an antidepressant or give you a anti-inflammatory for that joint pain. And we're really focusing on root cause. And not only with the hormone therapy to make you feel better now, as I tell all my patients, I will make you feel better in one way or another, maybe not 100%, but we're looking at long-term health benefits.
When I first came here, I emotionally, physically, mentally was not good. And I recognized that. I couldn't push through it anymore. One of the things that my physician said is you have to lose weight. I didn't have the energy to lose weight. One of the things that I've recommended lots of my friends, my neighbors, my coworkers, is that hormone replacement gave me so much energy. I was able to exercise without hurting, but I also had the mental capacity. Like, you get this brain fog with menopause, and it was affecting my work. And that immediately, like, it was just like euphoric. I don't know.
The sky has opened.
Yeah, it's just, I didn't realize, and my husband did actually, but I didn't realize how much hormones really kind of guide physically, mentally, spiritually, all of that. It's changed my life so much so that this last year I lost my husband. And I tell Sharon and my girlfriends and even my coworkers, I don't think I would have gotten through this grief phase, still going through it. I really am going to tell you that I don't think I could have gotten through it without having the clarity, the energy, and the focus to really sit with that grief and be okay to get through it. And I say this, and I'm not being paid. It saved my life. I don't know if I could have gotten through that. And the other part is that it's not just you're going to get your hormone therapy replacement, but the staff here, and every point of contact that I've had over the year and a half has been supportive, and it's genuine. It's not like, oh, she's one of our patients. They really care. They ask about my well-being. They ask how I'm progressing through. I get my hormone replacement every 3 months. I know when I need it. As it starts to wear off, it's like, Sharon, I think I need to come and see you, not in 2 weeks, but this week.
What are you feeling when you feel like it's starting to wear off?
the hot flashes are coming back. The anxiety that I feel, my mood swings, it reverts right back again.
Yeah.
But the energy, it's like,
huge.
even my friends have said, I can't keep up with you. And I've always been that type of person. So, and then in my younger years, I went through infertility, right? So it's like, you went through infertility and then menopause, and you shouldn't have to just go through it. Yeah. There's help.
Yeah. Well, and the other thing we've done is in that last year and a half is you've lost a little bit of weight. So talk about that specifically. How has that changed? I know for me as a provider, I'm looking at blood work, blood pressure, cholesterol levels. By reducing the weight, we are reducing insulin resistance and heart disease long term. But right now, just with that little bit of weight loss, how are you feeling?
Well, what's been super significant is that I had to have my annual with my doctor. So I had all the blood work done with my physician, who's wonderful. I love her. And she did a physical, got the blood work back, and she said, "What are you doing?" And I said, "Well, what do you mean?" And she goes, "Well, your weight loss is significant, your blood work has completely reversed 120%. So whatever you're doing, keep doing it. So I felt good about that because that came full circle.
Yeah.
Right. So I talked to her about my hormone replacement. I also talked to her about my weight loss journey because that had reached through stress and anxiety and menopause because I didn't have the energy to work out. You know, the doctors say you have to lose weight, you have to work out. I couldn't. But I've lost over 45 pounds with Sharon's help, and I feel so much better. So not only did I lose the weight, but my overall physical, like my labs have, when your physician says, "What are you doing? Keep on doing it." It gives me the, I don't know. I
pat on the back, like you're doing it.
I feel proud of myself because I don't know if I could have done it without a little bit of help. And it does. I have changed my lifestyle. I am working out. I am thinking about better choices when I am on the run, going from meeting to meeting. It's like, do I really want that, or do I really want to stay on this journey? Because I feel so much better.
We've really got to know you on a personal level. That just makes it so much more special and meaningful. I do want to hit on something where you're referring to seeing your primary care doctor. I'm a nurse practitioner. We do have some patients that see us completely just for primary care, but a lot of our patients use this as an adjunct. Again, in primary care, those doctors are so overworked. Our system is broken. We cannot meet the demand. So your visits with primary care can be very rushed and really not going in deep to some of the sources of the issues. So for you still see your primary care, you see me as well, and I think it gives you the best of both worlds. For me as a provider, when I hear all that positive feedback from your doctors, I'm like, oh, thank you, Jesus, like we are doing something right. So it's very validating for me as well. So for our patients, that message is, it's not a one-stop shop. It's a lot of layering of treatments, layering of opinions, professional opinions, assessments. So I think you're a perfect example of that. So yeah, we're just so excited to have you in our practice.
Thank you. Thank you. And like I said, everyone that's a part of this team, it's not like, oh, I do this and she does that. They all come together cohesively to support the patients, especially me. I've gotten to know each one of them and utilize a lot of other services here. And so I'm so thankful. And I'm thankful for my husband who for years have said, this works. And you don't usually have your husband saying that, but the one thing that when I would say, oh, I've researched it, it cost a lot. And he said, and this is great for husbands, right? Your health is an investment.
Yeah.
Your health is worth it. And so when you kind of package it like that, yeah, we're worth it. And we don't have to go through the side effects of menopause. There's help. And so I'm so thankful.
We love you to death.
I love you too.
So as we all know, perimenopause and menopause, it's going to happen. It's not a matter of if, but when. And depending on where you're at in your journey, we are here to educate our patients, to get the conversation going, get that information out there. Listening to Fran today, it's very heartwarming to know that we have been able to support you through this whole process. And if any of this resonates with you, reach out to us. Let's have that conversation. And let's just validate where you're at in this process and offer you the resources that you deserve. As we develop this relationship with you and get to know you, those subsequent visits are going to include blood work. We've got to see what those hormone levels are, thyroid function, and again, we're diving into gut health. Different things that will be going on is routine screening, colonoscopies. Yes, we all have to do them at a certain age. We can certainly refer you out to specialists to get that done. Mammograms. Again, we're assessing risk factors. When do we need to start doing that? Sometimes it's actually an ultrasound or an MRI. We have great resources in our community where we can all work together and, again, prevent disease. As time goes on, we're evaluating your health, how you respond, and again, any risk factors that we can address, and make sure you're getting your routine screening process going and maintaining your health. So, of course, one of the key features in our approach to overall health is weight management. How many times have you gone to the doctor and they're like, hey, you need to lose weight and exercise? We all know that. It's much easier said than done. Here in our setting, we address weight with GLP-1s, your Ozempic, Mounjaro, and I think they're great medications, but we have to remember it's a tool. There's still a lot of work that we have to support our patients with their weight journey. Specifically, we do not want them burning muscle for energy. We want to burn that fat. We want to hang on to muscle. Here in our office, we can do a body scan to monitor muscle mass, make sure we're giving you exactly the right amount of protein you need each day in your daily intake, as well as making sure you're on a good weight resistance training program. These are important factors, and again, long-term, we're reducing diabetes, high blood pressure, and heart disease by just getting that weight down. Additionally, joint pain. A lot of menopause patients come to us because their joints hurt, and that's definitely a sign of low estrogen. But by losing 1 pound of weight, you're taking 10 pounds of pressure off your joints. So times that by even 10 pounds, 20 pounds, those joints are gonna love you so much better, and that longevity will be there. So as I mentioned, yes, I am a type 1 diabetic, and I really don't throw that out there often, but the reason is I want you to know I am fighting the fight right with you. I am having to eat healthy. I'm having to stay active. It's the same thing to prevent further disease down the road. So if anything you've heard in this video resonates, if you're suffering from fatigue, getting through that workday, or having your symptoms affect your profession or your relationship or your overall wellness, please feel free to reach out. In the meantime, subscribe and like this channel. And I want to hear your comments. I want to know how you guys are feeling. I love to educate my audience and my patients. So we are here for you when you want to have that conversation.